Thanks for staying with us. So World Oral Day is a day set aside by FDI World Dental Federation. The day is marked every 20th of March. The campaign is dedicated to raise global awareness on the issues around oral health and the importance of oral hygiene in our daily lives. Join us now to discuss more on this segment is Dr. Olufunmilayo Adeniyi. She's a dentist and the founder and clinical director of Lux Dental Clinic Limited, Lagos, Nigeria. Welcome to the show, madam.
Thank you very much, ma'am.
The dentist. We all hate the dentist.
Do you?
Because, you know, let's start with how do we begin to remind Nigerians on the importance of dental care? How do you go for your routine checks? How often should we go for our routine checks? And when do we know it's time for a routine check? Because we just never do these things. We just let it be until we start feeling pain. That's when they start calling you. So what's the proper routine for dental checks?
Okay, so it's recommended that you visit your dentist every 6 months. Every 6 months, so at least twice a year. But with some people who produce more dirt, more calculus in their mouth, we might even ask for 4 months. Every pregnant woman should routinely see a dentist during the course of pregnancy because of the pregnancy hormones affect your gums and your mouth adversely, and so you need to ensure that you are in tip-top shape.
Wow. Well, I would like to start with kids because I know we'll come to adults because the kids, all my children, they are just yellow. They're all yellow.
Yeah.
And I brush their teeth for them, but somehow, is that normal? Will they get white in future? Or what's the plan? How do we fix this?
Okay, I like to say your toothbrush is not enough, and so you have to invest in a visit to the dentist. Thing is, with children, their manual dexterity is not as they don't have the prowess that we do, and so they need supervision a lot of times till they're about 7 years of age. At the point where they have mixed dentition, primary and permanent teeth, you notice the primary teeth are whiter naturally than the permanent teeth, and then you need to just take them to a dentist.
Okay, so you know this. I know that this is what you do. What Mariah is saying is my reality. I didn't see a dentist while I was growing up, and my teeth is pretty. You know, I'm really good. It's not yellow, you know, but my kids are yellow, and like I wonder if it is if the color of the teeth has to do with genetics, or because some people just have yellow teeth and then some have white teeth. So I'm like wondering, is this something I'm doing wrong, or it is something that's genetical?
Did it toothpaste?
Yeah.
Is it brush?
Okay, so there are many factors. Yes, genetics play a role. Many times you see that people's teeth match their eye color, and so genetics play a role in how dark or how light your teeth are. But regular oral health practices can help brighten teeth. But in the end, having healthy oral having a healthy mouth is not just about the color of your teeth. Yes. It's about how healthy your gums are. Do you bleed when you brush? Do you have mobile teeth? Do you have holes in your teeth? So those are the things that we should be focusing on.
Sorry,
beyond
did you say mobile teeth?
Yes.
What is mobile teeth again?
Teeth that shake. Teeth that shake, that are not firmly placed because there's something going on with the gums and the connective tissue.
I was afraid that the teeth would be walking out of the mouth.
Let's talk about how teeth grow.
Yeah.
So I have a perfect dentition amongst my siblings. I've never bothered. And it's been white all my life. It's just getting brown or yellow. But I have children, and I've never seen these teeth before in my life. My eldest child doesn't lose a teeth.
Yeah.
A tooth. She pushes one out
as the other is coming out.
So you will never see a hole.
Yeah.
Oh, really?
She's lost one, but there's another one there right away. Then
It's scattered.
God of mercy. Now the second one, teeth like this, strange and
Different shapes.
Worry.
Okay,
will it fix itself?
Yeah, will it fix itself? Because that's what family are saying, that go leave it, don't touch it. But I think something should be done.
Okay, so this is usually the mixed dentition phase. That's when the milk teeth are falling out and the permanent teeth are coming in. Some children have that. I, growing up, never had a hole. I never had a gap. I always had the permanent teeth growing right behind my primary teeth. But my mom is a pharmacist, so she would take me to the dentist to just say, what's going on? And I grew up in a teaching hospital, so it was easy to just walk into the dentist and say, what's happening here? And then there's a lot that can be nipped in the bud if they see a dentist at this stage. Right. Yes. And so don't just say, oh, everything is fine, because the diet you were exposed to is not the same diet your children are exposed to.
Certainly.
Your children didn't take sugar to school every day. They didn't have this much exposure to carbonated drinks and refined sugars. And so we need to invest. We need to be very intentional about taking care of our children's teeth and our mouths, because now we're finding a lot of studies saying that all chronic diseases are linked to everything happening in our mouth, and so it starts there. And yeah.
So what's the safest way? Because now I've tried to floss. The gums were just bleeding. I floss easily, but when I do for my second child, I think the gums are just soft. Or is it that? Can somebody's gum be that soft genetically enough for a floss to tear them?
Okay,
How do I do it?
We call that gingivitis. That's the inflammation of the gums, the redness of the gums, which can be reversed by a routine visit to a dentist. So a procedure we call scaling and polishing. That's the truth. Your toothbrush is not enough. And with our lifestyle choices now, there's so much at stake that we can't afford to just say, oh, I'm brushing at home and I'm flossing at home. There's a lot that gets stuck in between your gums. There's a lot that gets stuck underneath your gums, between your teeth and your gums.
I'm carrying my 4 children to come see you. Because my little boy had an accident when he was a little baby. He fell on something, and one of his tooth chipped like all the way up to the roots. So we went to the doctor. They got him something to cover it up, but it's gone off. So he's back to normal now. I'm only praying that Father, Lord Almighty, and when it's time for it will affect the real covenant. Will it, or should I just, because now it looks like he has a gap, but he really doesn't have a gap.
Okay, so in that case, usually we'll do a root treatment when there's trauma to the primary teeth at that stage. Usually there should be a root treatment done to just clean out all the blood vessels and nerves and create a pathway so that there's no infection that affects the permanent tooth. But hopefully.
My daughter took her kids last year. They were 3 and 1+ to the dentist. The dentist said, oh, no more sweets, especially lollipops.
Yeah.
And we are all guilty of giving our kids lollipops.
Yes.
According to the dentist, the lollipop, because they just keep it in their mouth permanently, it decays the teeth. And then she has another routine. She brushes their teeth for, I think, 3 minutes. She sings 6 green bottles till, and each one, the first one, the younger one, is just like 1.5 minutes. The older one is 3 minutes. I have to do it myself for her when I'm
Is it how long or how well, though?
It's both. You need the time to do it well. And so but she's doing great. She's doing excellently well. So you should do at least 2 minutes brushing. Yes. You should do at
What
least
of
2
a
minutes.
child that, you can't brush some children?
Oh, you can. Find what works. Find what gets your children's attention.
So they brush, my son from 3, like even 3 years, brushes himself and actually does a better job than older ones. Like he does it really well. He'll brush his tongue, but he does not want you to help him to brush it because he's worried about the choking. So so he does it himself, and he actually really, really does well. But the supervision is the part that we need to work on. Many Nigerians right now are watching us and wondering, oh, there's no diesel, we are hungry. Why should I be bothered about my
dentist?
See the dentist. Like, this is not the most important thing for me. Yet I know it is very important. So can you highlight? I've extracted 2 from my 32. So when I smile now, it's 30 that is smiling. And I'm worried that I would need to extract more. So I understand it's important, but someone watching probably would want to. In order of priority, how would you explain spending that money on dental care?
Okay, I have some clients who are in their 60s and they had this laissez-faire attitude to their mouth when they were younger. And so they'll say, you have a hole, and say, just take it out, just take it out. And now in their 60s, they barely have anything to chew with. And they're spending millions on implants because now their faces are sinking in. Because really, your teeth are the pillars that hold your face. Wow. So you see some people looking really aged because their teeth are yellow, because there's spaces and there's nothing to hold up the cheeks. And so just invest in your oral health. I like to say we talk with our mouths, we eat with our mouths, we kiss with our mouths, we do everything literally with our mouths. Yes. So there's just and prevention is cheaper than waiting till there's pain and there's something to get rid of. So just invest in a routine check.
This brushing twice a day. Is it a real? It's like, is it a real must?
It's real. It's real. It's real. It's just like having food pile up here all day. 8 a.m. you eat something, you throw it here. By 9 a.m. there's something in, there's water, there's sugar and everything, and it begins to rot on the table. It's literally the same thing in there. And then you have a lot of microorganisms naturally in your mouth that are acting on everything that comes in. So you need to break the cycle.
Except I'm on my period, I don't have this effect you talk about. Maybe because I have to rinse my mouth 5 times to pray.
Yeah.
And even more 3 times for each prayer. I hardly have leftovers in my mouth. So when I used to do the night brushing, it was just like fashion for me, really.
So you don't do it again?
I really don't have to. I don't have anything in my mouth at night. When I
do it too.
But when I'm on my period,
You brush.
and I'm not having to do my ablutions, I have to then
You know,
brush.
I think I shared that story before. My husband, I mean, since I've met him, morning, night. So in the early days of our marriage, I just wanted to, this guy doesn't want to be, the guy is as if I'm begging him to kiss. It was later, it was about 2 or 3 years, I was like, Auntie, you don't brush at night. It's difficult to be kissing you at night. So, I mean, so it's horrible. So I think you not tell me now that I'll be brushing. Is it because, so that brushing, it took me a long time to start brushing at night. But I'm happy that it's really important, as you've said. Yeah.
Someone is asking on Twitter, I say, brushing twice a day also, if you can use kpapo. What is it?
Yes,
I was going to go there because my father was an advocate for chewing stick, and there's this one, the one with the pepper.
Yeah.
That is supposed to be
The tobacco
or something Ataya.
So that's that one. And then another thing that happened to me as a child, there are these, I don't know whether they are quacks or whether they are real, where you will take them, they will put something in your nose, and then maggots will come out of your mouth.
Ew, damn.
No, those ones that used to put on your wool and put on your teeth.
No,
if you have a
put it in your nose.
There are some they put in your teeth too.
There are some, I saw those ones in the bus.
And
How safe are all these things?
So
What are those? What is that?
Have you heard about it though?
The thing will nearly turn your head.
Yes.
Let her explain to us what that is.
Okay, so for using bako chewing stick, we have proven methods, natural methods of curing oral diseases in Africa, but we haven't explored intentionally. There's not enough research to back up. My mom is a pharmacist and she's done a lot of research in that. That's how I know that. And it is proven to be able to reduce the oral microbe that you have there. But we don't have enough proof. How long do you brush it with? So that's why there's no scientific backing to it. So that's why we always say, just stick with the toothpaste because we know how much... Or do both, if you insist, or do both, yeah.
And the maggot part?
The maggot part is just, people are out to make money. They use chemicals that react and coagulate with your saliva and have that squirmy look. There is no worm anywhere in your mouth.
I say, see your life?
There is no
You see your life? Is it me?
There is no worm. People are just out to make money and they use different chemicals.
Man, they made money off my dad.
These are the
They will count each maggot. If my father did the whole
I've had clients that come into the clinic saying that they told me I had maggots and that you should do something else. But in the end, you need to see it then.
Okay, so let's talk about braces.
That guy, I knew he was a 419.
It just made money.
Braces.
Let's talk about braces and the types of braces, why people should do braces.
What age?
I see adults do braces a lot nowadays, and I have a client, she wants to, she's had the gap, the AG. She's had it like forever, but I feel it's so cute. But then she's going to be 50, and she said, guys know that I'm going to be 50 without this gap. Everybody knows me with this gap, but I'm going to be 50 without the gap, and she now has braces on. When is braces essential, and when is it superficial or necessary?
Okay, so people grow up with malocclusions. Say you have spaces between your teeth, spaces between your teeth, or you have crowded teeth that overlap, or you have teeth that bite way ahead of the lower one, and so you have this loop, or there's an underbite where your lower jaw goes ahead of the upper jaw. There are many malocclusions, and it affects speech, it affects chewing, it affects natural functions of the mouth, and so getting cures for the malocclusions are very valid because many people have esteem issues from this. You might not know. I met a teenager in the office one time, and his mom was just concerned. He never smiles. I don't know what is wrong with him since he became a teenager. And I just had a few minutes with him, and he said he doesn't like his teeth. He doesn't like the way his teeth are set up. His friends laugh at him in school. And a simple procedure using braces corrected all that.
Oh, wow.
It happens with women also. I had a lady who came in and her husband said, no, I like you like that. But she's like, I'm not confident. I feel like people, I'm so self-conscious. I feel like people are always looking at my mouth. And so I need to go for it. And then if you feel like you need to do something about the way your teeth are arranged, please go for it. Braces are effective, and they're also aligners. Aligners are not as visible as braces. So it's just a nice, transparent thing that you wear on the...
I have a message here from somebody. It says that I did a root canal therapy in 2009, but didn't complete the process. She was supposed to crown it. I don't know what that means. She said now the field hole broke out and while she was flossing. How does that... Can that person be helped?
Yes, probably with an implant. That's why we literally beg them, please come in. Once you get a root...
Well, you people are so expensive. That's why people run.
Because you do not come in at the right time. If you come in every 6 months and all you're doing is a basic cleaning, at the most in a year, you are spending 20-something thousand, 30,000. And long term, there's no hole that can progress so much. In
Auntie, you know what? I have 4 children. It's when you tell people, I times it and 4 children myself.
Someone is asking on Twitter, I have a question for the dentist. I have a natural gap tooth and it is too wide. Can I cover it up? Is it advisable?
It's best to use braces and aligners because our teeth are arranged. There's a structure. So if you cover it, you're adding an extra tooth that is not there. You would look weird. There's a beauty in the natural design of our teeth. And so when you need to move teeth, you move them in sections. Like some people ask me, can I put braces on just one corner of my tooth? No, we can't. We treat your mouth as a whole. And so we moved them together. So
let me take Hassan. Good morning, Hassan. Are you there?
Yeah. Good morning.
Morning, live. Go ahead.
Please, I have a question for the dentist.
Yes.
Please, what are the causes of this mouth odor? And is being, what they call it, being an ulcer patient, it makes somebody's mouth to smell.
Being an ulcer patient.
And what are the remedies for it?
Yeah, the ways. What causes mouth odor and if that's also
Okay. So there are very many causes of mouth odor. There's the physiological cause where you just wake up and you have your mouth is off or you're fasting. You're not taking as much water and food, and so that happens. Then there's the cause by holes, having holes in your mouth. There's a cavity. It's literally a cesspool of bacteria and decayed food, and so there's bound to be halitosis. If you have gum diseases also, you bleed when you brush. There's just that off smell because your blood should be in your blood vessels. It shouldn't be mixing with food and saliva. Then when there's some systemic diseases, say liver conditions, kidney conditions, or just many systemic diseases that have something going on in there, it can affect your breath. And smoking, consumption of alcohol, all that affects the smell that comes out of your mouth. And so what can you do about it? Visit a dentist.
Everything goes back to visiting the dentist.
They've already seen everything we knew as a child. So when we were children, I would take like 4. And you'll be answering them one by one. They used to brush like this, up, down.
Yes.
Up, down. And one dentist that wanted to make money off me said, your gums have been damaged with the up, down. So you have to do like this.
Yeah, rotation. Yeah. And they'll come again with another one. They do like, like that. So what is all this? Like they keep changing all the involves. They keep changing the formula.
Okay, the thing is, the 2 approved methods presently are the light circular movement. But the truth is, people just tend to be aggressive. And in the end, it goes back to being forward and backward or this. So the 2 approved methods are light circular movement or light flick, where you are taking your brush from the top of your gums. You're literally bringing out all the dirt that might be stuck between your gums and your teeth and flicking them out gently.
So it's not like this.
The
up and down.
You can, but there must be a slight move. 2 minutes. But you have to just think about it. Like treat your teeth with love and attention.
You don't have time. This is Nigeria. You miss the bus.
So there are some people on YouTube that are asking about mouthwash. That is mouth can mouthwash be a substitute?
Okay, before I go there, I want to say the way you hold your toothbrush is also a factor. No firm hammer grip, just a light movement, treating your teeth with tender care and affection. Because that, in the end, it causes cervical abrasion where you lose the edges of your teeth and your
Let me
gum.
take this call. Ayokole, are you there? Thanks for calling. Oh, I'm so sorry, Ayokole, for keeping you.
So the second one, somebody came.
Okay, I'm not done with the mouthwash.
Mouthwash,
Okay.
yes, please.
Yes, mouthwash. Okay, so the truth is that dentists are not huge advocates for mouthwashes.
Oh, really?
Because a lot of mouthwashes contain alcohol, which dry out your mouth. And in the end, you're going back to square one. You're doing more damage than good. And then if your mouthwash also there's some really concentrated ones that just disturb the whole pH and the ecosystem in your mouth. And so in the end, we say rinse with water. If you go for a mouthwash, make sure it is one recommended by your dentist. There are few that do not contain alcohol. They contain fluoride, and they have the right pH for your mouth, because there's a level of acidity that you don't want to get to. Because
But we think is that the more acidic it is, the better it is.
Because people feel like, oh, once it smells
and
and
feeling
it's yes, you do.
So I even heard one fabu that
Eh?
if you use mouthwash, you won't catch koro.
Hey.
Actually, some people said that, but there's not enough proof. But it was actually conducted that a lot of mouth washing and spitting out actually helped to reduce the oral overload.
Mikey, where do you get all this data from?
Mikey,
fierce like.
But it was
There's
widely
another one
spread then.
on Twitter that said that when we brush, we shouldn't rinse out. All our lives we're rinsing out.
Yeah, I've been sort of doing
So
that.
if you brush, they say you leave the fluoride to work.
You're kidding me.
Yeah.
So you not leave that. Ew.
So we advise
At
that
night,
you
yeah.
spit, you do not rinse. So
Yes.
spit, but don't rinse out with water, so that there's a little left to act on your teeth.
Yep, I've been doing that.
That's
Please,
the
why you know
advice.
this? You see, there was a time that you people said the
There's
fluoride.
sweetness in them.
Some,
leave them
not,
in your mouth?
but that's why you should go for one that is approved by a dental
Exactly.
They
association.
all of them.
No, not all, not all.
If I call
The
this
one
Some
I
of them
use,
have
I will tell you.
xylitol, which is safe in your mouth, and it's not a sugar that the bacteria can act
So
on.
let me get this clear. If I brush in the morning,
Yeah.
after I brush, I just spit out. I shouldn't rinse
Yes,
out.
just
I never
spit.
heard that before.
I've heard it.
Yes.
I've
And
heard
I
it.
do it.
My
Wow, you know
daughter
what is
doesn't rinse out her children's mouth.
It's
Once they brush, it's okay. She herself doesn't do it. But me, I
Yeah, by
grow
being-
up
I have
with
not
been
some
rinsing
people
out
spitting
our
and rinsing. In fact, not only will you
some
rinse,
people-
you gargle.
Yes, now.
Actually
She's
brush
shining here.
after
to clean
you had
it.
breakfast, so they're not eating after you brush immediately. But I wanted
Okay, we usually advise that you give some time after eating before you brush, because once you eat, there's the action of
digest
microorganisms that create acid in your mouth, and so once you brush, you're weakening your enamel immediately. So it's good to give it a few minutes before you brush after eating, if you insist on brushing.
Sorry, I want to stay on this matter. This water matter. Because when I rinse out, some particles do come out. So if I had left it, the particle would remain in my mouth.
No, if you brushed for 2 minutes, you'd spit in between the 2 minutes.
Ah.
You won't be able to keep in all the toothpaste there in your mouth for 2 minutes. So you spit out, you rinse a little, you do it again, and then the last bit you just spit out.
Ah.
And leave it to act.
Yeah.
And you'll see that your breath smells slightly fresher when you do that
Ah.
than when you rinse it.
I never liked the minty breath. I had that problem because that was the problem I had with my husband, because he was
always minty.
minty. So at night I'm like, oh no, I used to be like,
all
I'm smelly, he's minty, and we're both like, so kissing was
You're not getting each other. Oh, different wavelengths, please.
Oh, my
I want to
Lord.
ask you about the mechanical toothbrushes. So I have friends that use it, and I know that many people in the America they use it a lot. So, but we here tend to use the normal brushes. So, which would you say is better if you're trying to correct damages?
Okay, so the automatic toothbrushes are suited to help you do it right. So it is doing the circular motion for you. All you have to do is just hold it, and it doesn't apply as much force as when you're scrubbing.
Interesting.
And so it is safer Most dentists would advise that if you can get an automatic toothbrush, just do it. Get an hourglass, a timer, and in 2 minutes, just make sure you are moving it. It's not like you just leave it in one corner. You are moving it around all the surfaces of your teeth.
No, me, I use this one that does zzz, and I still do.
Yeah.
You shouldn't be doing this.
You shouldn't be. Yes, it shouldn't be too. You shouldn't be aggressive.
It's not.
So this world
just light and gentle.
So this World Oral Day that I celebrated, what's the theme for this year? Is there a particular message that they have this year for people?
Yes, this year is be proud of your mouth for health. So the point is your oral health is directly linked to everything that is happening in your body. And so invest in your oral health, invest in everything happening in your mouth so you can be healthier, because you can't isolate your mouth and say, oh, I'm healthy, but my mouth is, yes, it doesn't work that way.
Okay.
So be proud of your mouth. Look into your mouth and be sure I don't have holes, I don't have gum disease, my breath is smelling good, and that's basically...
Okay, go ahead.
The last time I went for medical check, I had like 4 holes. And when they gave me the total calculation of filling it, I was like, I could only do 2. So and that was last year. So and I said, fill the 2 most damaged ones, and let us keep the remaining 2. Now that I got there, I realize that I'm already overdue for checking. But when someone is facing that reality, what can you do when you know you have holes and your budget cannot accommodate filling it? What can you now do in between? Are there meals you avoid? What are the routines that can help?
Okay, so the truth is, in the end, once you have a hole, you have to fill it because it will keep progressing. There's no hole that is static, that just stays there. It keeps growing. The hole has living microorganisms that are feeding it with acid that break down your teeth further. Wow. And the truth is, your teeth are one of the strongest structures on earth. So it takes a long time for holes to progress. That's why we always say visit a dentist every 6 months, because we can nip it in the bud. Once it's in the enamel, that's the first layer. All you have to do is just slap on a tiny filling. There's nothing big. Once it goes into the dentin, you begin to feel sensitivity and pain.
That slap on
once
is
it
money.
Gets into
Once
it gets into the pulp, we're talking about root canals, then you have to get a crown because the tooth is now weak. So the farther it progresses, the more expensive it becomes. And so
I have a call from Butarkas. Nicole, good morning. Are you there?
Everybody is visiting their dentist now.
Good morning, Nicole. Are you there? Hello, Nicole. Okay, I think we lost that call.
So we have plenty tweets. But the last myth is someone saying on Twitter now that don't brush your tongue. Don't scrape your tongue after brushing when you brush. Your tongue is too sensitive. That's your place.
Oh no, you should brush your tongue because there's a lot of microorganisms that live there. There's a lot of food that gets stuck in between your papillae, and so you need to clean it out. A lot of bad breath actually originates from a dirty tongue. Yes. So I know some people like to invest in tongue cleaners, and that's very valid, so that you have something separate cleaning out your tongue.
Use knife.
No, a knife.
Someone, I think Boa is saying that you dentists should leave your comfort zone and spend time researching on the benefits of chewing sticks. What would you answer to him?
Oh, there's a lot of work going on there. I had professors in my College of Medicine who already started work, and there's a lot going on actively. But who is funding the research? Because there's a lot of research going on, but there's no funding. The Chinese,
slows the pace.
Yes, the Chinese research, and they back it up with money, and they send it all over the world, and we buy the Chinese products, and so it's seen as bona fide. But we research, and nobody is funding it. Right. Nobody is funding it, so it just goes into the books. So only when you go into the field of academics before you see
how much work has been done.
Yes,
the body of work has been done.
There's so much.
Another person, Ajumu, sorry, Nima, is saying, is it right to brush your teeth with bicarbonate soda?
Yes.
Oh no, not at all. Not at all.
But they use that. What about activated charcoal?
No, it's not advisable.
People sell activated charcoal.
Yes, people do. But who is endorsing it? The thing is, there's a lot of self-help, especially now with the advent of the internet.
But we have been using ashes. So since when I was small, whenever we have mouth something, we used to go to the silent pot and take the ashes.
Well, it's not standardized. It's not standardized. I had a case of a mother and a child who came into the clinic with this. They got charcoal, and then all their gums were burnt out. Gums and the They don't know what wood was burnt. They don't know what wood was burnt to become charcoal. So there's no standardization. There's nothing to guide it. You don't know what if it was a poisoned wood you ate. If it is.
So my worry from what you said so far is that we have all this knowledge, just like the charcoal, the maggot stuff. We have all this knowledge, but we're not documenting it properly. Because there's a lady.
We can't rely on it.
There's a lady that this is just the side. This lady was massaged my mom for many years, and she is phenomenal. My brother has been spending thousands of dollars in the U.S. When he came home and this woman massaged him, he was shocked. He said, Maria, I've gone to South Africa, I've been to Canada, different countries, and nobody has touched me the way this woman touched me. We now told the woman, wait, set up something. Let us even fund this thing, because you have to train more people. We said her mother trained her, and her grandmother, they passed it down. She's already in her 60s. So we're trying to get her to train more people. If I have money, I will support that woman, because what she knows that work. She knows every single bone. She's so fantastic. So it's the same thing. We have all this knowledge, and there's nobody funding it.
And there's nobody documenting the body of knowledge,
the process.
knowing like this is what we do that leads to this. And that's the difference between the foreign world and here. They document. Once you find something, you write a book. But who says that what you've written in your book is the fact? You just have a empirical formula, empirical facts to prove that this and this and this. And that's what we need to start doing in Africa.
Okay, after saying, I had a teeth damage by a drug as a child. I have done washing, and it still remains light yellow. Whitening an advisable option?
It is a viable option, but you need to see your dentist, because if it is, say, tetracycline stain, whitening will not do much for you. You might be looking at veneers, at crowns to get that.
What about lemon water? Is it good for healing infection gums?
Lemon water is highly acidic, and so it causes erosion in the long run, where it's wearing off, taking away all the enamel that covers your teeth. I like to say that lemon water is bringing a lot of clients to dentists, because people are so sensitive in their teeth now. They can't smile. They feel that shocking sensation because of the amount of acidity.
There's an important text from Yemi Akumi. She says, how long do we use a toothbrush for? And also her 2-year-old doesn't let her wash his mouth. She says, can I take him to the dentist? His teeth are getting yellow.
Okay, so you use a toothbrush for 3 months, but if in that period you have, say, a cold, or you come down with any illness, please change the toothbrush, because in the period of being sick, everything in your mouth has recalibrated, and you don't want to carry that on once you're feeling better. Yes. So change your toothbrush every 3 months. Your children should start visiting the dentist once the teeth are erupting in their mouth. Really.
And teacher, the whole conversation on this table, we come to the dentist. Okay, we have heard. Me, I'll definitely bring my children, because I definitely, I just need the dentist.
They've never been to a dentist, so.
Yeah, I think they need a
They've never been to a dentist, your children?
My kids too. Only Elizabeth. The other ones haven't been to dentists.
Well, my daughter, she took her own children.
She's doing really well. She's doing really well.
Yes, now they don't have problems.
No, there's no NHS for dentists. There is no NHS for dentists in
they have water, they have electricity, they have work on mobile, they can take their children to dentists. Here, there's a lot of thinking. Generator is there. We are thinking of how we're going to play in Kokpot and all right. Thank you very much, madam, for joining. It was a pleasure having you on the show. Okay, that's all we can take. Take your kids to the dentist. Take yourself to the dentist.
Many questions here on Twitter.
Really?
On YouTube.
Have a great day. We'll see you tomorrow. Bye for now.
Bye.